Hi, good morning, good afternoon, and good evening from Texila International University, as well as we are now 10th Texila World Conference for Scholars under the theme of artificial intelligence and the future of teaching and learning, navigating a virtual frontier. And today is the first day, 16th May 2024. We have the conference online, and today's quote: education is the key to unlock the golden door of freedom. So we are going to start the session one. Let's start our first day. Dear Excellencies, distinguished delegates, scholars, and scientists, it's my pleasure to be the session chair of the day. My name is Dr. Rakesh. I'm the host for the conference. Today, on behalf of Texila e-Conference, I would like to extend a warm welcome for the 10th Texila World Conference for Scholars. Texila e-Conference is conducting conferences for 10 years in a row. Texila has made a revolution in the way scholars attend academic conference and has attracted more than 9,500 participants from 90 plus different countries. Texila e-Conference stands in the front row conducting virtual conferences, saving your valuable time, money, and guarantee the comfort you require. The topic for this year is artificial intelligence and the future of teaching and learning, navigating a virtual frontier. The primary reason why we have the chosen the theme artificial intelligence and the future of teaching and learning, navigating a virtual frontier for our conference, because it represents a critical intersection of technology and education. The primary reason we have chosen the theme as AI continues to advance, its impact on teaching and learning is becoming increasingly profound. By founding on this theme, we aim to provide a platform for scholars, educators, researchers, and the industry professionals to explore the latest innovation, challenges, and opportunities in leveraging AI for educational purposes. Additionally, in today's digital age, virtual learning environments are becoming more prevalent, and understanding how AI can enhance the environment in essentials. This theme encourages discussions on how AI can revolutionize approaches, personalized learning experiences, and address the needs of diverse learners. Ultimately, by navigating the virtual frontier, we can shape the future of education and ensure the learners are equipped with skills and knowledges needed to thrive in AI-driven world. So this conference offers an invaluable platform to explore emerging trends, address challenges, and envisions a new paradigm for education that ensures lifelong learning and equitable access for all. So before the conference, I conclude, dear all, I want to share a few operating instructions for the participants. All participants should check your speaker settings to make sure the presentation is audible. Those who are making presentations, please enable your mic from the toolbar at the top and share your webcam by clicking on the start webcam from the slide bar. At the end of each presentation, there will be a Q&A session for 10 minutes, wherein you can post your questions and it will be answered. So let's begin the session one. I request Mukiibi Michael to present on the topic viability of a smartphone application on accessibility to information on maternal, newborn, and child health care in slum settlements in Uganda. I request Mr. Mukiibi Michael to present on the topic.
Morning from Uganda. I'm calling you from, I'm speaking from Kampala. I am very happy to be a part of this, what I think is a groundbreaking conversation about artificial intelligence and what the opportunities that it presents. And in my case, I saw it as an opportunity to present what I did as part of my PhD research to improve information on maternal, newborn, and child health care in slum settlements in Uganda. So that's my topic. I wanted to see the viability of a smartphone application on accessibility to information on maternal, newborn, and child health care in slum settlements in Uganda. My name is Michael Mukiibi. and I'm happy to be here. I had two objectives for my research. Four objectives. One was to assess the magnitude of infant and maternal health outcomes in slum settlements in Kampala City. Two was to establish the accessibility of infant and maternal health care information by slum dwellers in Kampala City. Three was to develop a smartphone application that can access that can address the accessibility to information on infant and maternal health. And then the fourth one was to pilot test that smartphone application within the study area. The order of these objectives was intentional, with the assessment of the magnitude and the establishment of the accessibility of infant and maternal health information by slum settlements, by slum dwellers in Kampala City, forming the first phase of this study, because the study was divided into three phases. And then the third objective was actually also the second phase of the study. And then what objective was the third phase of the study. So it was all supportive of each other. The first and the second objective feed into the third objective, informed the third objective, which was to develop a smartphone application. And then, of course, once the smartphone application was developed, we had to pilot test it, hence the three phases of the study. I just wanted to make that very clear at the beginning of this presentation. As a background, we know that slum settlements are usually marked by several problems: inadequacy in healthcare infrastructure and socioeconomic barriers being one. And yet, there is a recorded increasing smartphone use in these areas, which presents new opportunities for AI, for health education and consultation. And I thought that addressing these challenges requires innovative solutions to improve healthcare outcomes. The entire study was predicated on the information system success model, which is based on ensuring that systems, when developed, are of quality, and then the information that comes from them is of quality, and then they are easy to use. Such systems, automated systems, and then users are easily satisfied, and they do present individual, impact at both individual and organizational levels. So it was the entire study was dedicated on that information system success model. Studies, as I mentioned earlier, demonstrate the effectiveness of mobile health in enhancing healthcare access, and yet challenges exist, but there are also opportunities in using smartphone applications for health information dissemination. And so, based on that, a cross-sectional quasi-experimental design was employed as the study design using a mixed methods approach. I've already mentioned the three phases, but I'll just reiterate that the first phase had to do with the first and second objective, which had to do with the assessment of what are the health outcomes in these slum settlements. What is the degree of accessibility of information? What is the ease of accessibility of this information? That forming the first phase of the study, and that I went into the field and administered questionnaires to understand that information. And then based on that information, the gaps identified thereof, developed a smartphone application, which was the second phase of the study, and then pilot test of the app in the study area. And this study was conducted across various slum settlements in Kampala's division. Now, there's 5 divisions in Kampala. I made sure that all the 5 divisions were reached because we have slums all over Kampala city, and these slum settlements are across all the 5 divisions of Kampala city. Convenience sampling, because we also work with the health care facilities, it was easier for us to find people in there, people to work with, respondents who were mothers and their children, and of course healthcare facility workers like nurse midwives. So convenience sampling was important because we needed to find the right kind of health care facilities in terms of profitability, in terms of willingness to work with us, and that was why convenience sampling was used to recruit participants. But also, it was easier to catch these study participants from the health facility. So if you went to the health facility and asked, and you would probably get into the book, into the registers, and then find who's the mother in this location, and in what trimester are they in of their pregnancy, because that the study was also based on the trimester of the pregnancy of each of the mothers. Just to provide more detail on the study population and how they come to determine, this study focused on women of childbearing age, 18 to 49 years, who resided in slum settlements of Kampala City, and these included pregnant women at any stage, the first, second, and third trimester, but also those that were in the postpartum period. The postpartum period is 6 to 8 weeks after delivery, and then mothers with infants aged 2 months to 1 year. These groups were targeted because they are high risk for pregnancy-related issues, and this intervention was ideally supposed to address the problems that this group potentially faces during and after pregnancy. So this enabled the effective evaluation of the intervention impact. So the sample size was 200, which was about 52% response rate based on the fact that we ideally wanted 384 of the women from slum settlements across the 5 divisions of Kampala, Kawempe, Rubaga, Central Division, Masinde, and Masawa divisions in Kampala. And the formula that I used to determine the sample size was referred to Morgan. I've already mentioned that convenience sampling was used. I've already mentioned most of it, but I would like to add also that surveys were conducted across all the 5 health facilities, and then also insights were obtained through interviews from first 14 experienced mothers and then 5 health facility in-charges to understand maternal and child health challenges and practices. So who are the 14? Who are the experienced mothers? The experienced mothers for this study were defined as those mothers who had had at least 2 pregnancies during their lifetime. So if you had 2 pregnancies in your lifetime, 2 and above, then it would bring you in and provide this insight. And so, as far as the results are concerned, I'm going to focus on 4 key results. Maybe at this point, I'd like to mention that I'll mention it later, but analysis of socioeconomic characteristics, marital and pregnancy status, health issues, distribution, development, and pilot testing of the app, including user feedback on usability and effectiveness, and then the feedback we received after the pilot testing of the app. This table shows a summary of demographic and socioeconomic characteristics as far as age, education, and occupation are concerned. And you can see that mothers between the ages of 25 to 29 years constituted 31%. As far as education is concerned, most of these people were actually educated up to secondary school level, 74%, which was commendable, and also presented us an opportunity to communicate easily, because it's easier to communicate with literate people than to, especially when we are talking about AI, when we are talking about these kinds of intervention. As far as the primary occupation is concerned, most of them worked from home. They were homemakers or domestic workers, but we also had quite a significant number of them, 25%, who were either self-employed, especially those who indicated that they had small businesses. Please excuse my background. I can hear dogs barking in the background. I don't know if you hear them. But the second table, which is a summary of lifestyle and mobile app usage, also shows us that it shows us the primary occupations, the residency duration, the mobile phone ownership. Mobile phone ownership was very important for us to assess, because we could not have implemented this kind of solution if we were talking, if we were dealing with a group that not even own mobile phone mobile phones. We are talking about a mobile phone application, smartphone app here. So 99.5% had this was a very, very interesting finding, because it was actually an issue even at the level of the rest. So it was interesting to see that a lot of them had owned mobile phones. And then, when it came to how comfortable they were using apps, that's where the challenge was. That also there was not much challenge, except that only 63.5% indicated comfortability with use of apps. Okay? But those that were not very comfortable were only 6.5%. That was also very important, because this was a study that was involved the development of an app and the interaction with the app. This is what I wanted to talk about earlier, that I just realized that I put the wrong figure here. But this was supposed to be a figure that showed the rating of the general health status of the respondents and the children, because it was important that we underscore the problem of maternal and child health outcomes within the slums. Unfortunately, I mistakenly put it, and it was too late for me to change it. So, but this also showed, if we had put the right figure, that we actually had problems through the assessments that we did, indications that they had really serious issues regarding maternal and child health outcomes. Then we proceeded, because I worked with a team. I'm not an IT person. I was just a person with the idea. But this infographic shows how the app development procedure, which I can quickly tell you that, like I told you, a need was identified, a platform was created. This is an Android app, so we don't have the app on iOS yet. It's just an Android app. And then a series of processes were conducted, and then we came up with the app, which is called Apple, APHO, which is actually an acronym. I had to come up with that name because I wanted to put it on Google Play Store. So it's actually available in Google Play Store with that name. You can, even now as I speak, you can see if you have Android, You can quickly check it at AP with a small t and then a capital H and then a big O and then a capital A, APO. It's actually an acronym that stands for Application for Health Online. I just wanted to quickly go through. I don't know. Moderator, can you see this? I just clicked that. I just clicked the link. Can you see where the link has taken us? Just to confirm, because I wanted to demonstrate to you how the app works. Hello?
Yes, please. Yes, Mr. Michael.
You can see the new page.
I can see the screen here, but not the video.
What do you see interactive digital elements on your screen? No.
Please be louder, Mr. Michael. I'm not able to hear.
I'm shouting on top of my voice. I don't know why you can hear, but I wanted to show you how this works. Can you see anything on the screen other than my
Yes, the infographic showing app development procedure. That's a screen available in, it's viewed by all the persons.
Obviously, that didn't work out.
Okay.
Okay. All right, so let's move forward. But I wanted to demonstrate for you how the app works. Unfortunately, it has not worked. So moving on, this table shows, now this is at the level of, where we pilot tested the app. And the question here was, what do you wish was included in the app? All right, and we had 9 respondents, who included 14 experienced mothers and 5 facility in charges. So the question was, are there any teachers you'd like to see include the app? Are there those that answered no were 17 and those that answered yes were only 2, which was very, very important. And then this table answers shows you the question, the answers to the question, would you recommend this app to others in your community? So the percentage of respondents who were willing to recommend the app to others, which was a key indicator for effective usefulness and effectiveness, we had 100% of them saying that they would recommend this app to others in their community. So in conclusion, I would like to say that the smartphone application improves access to maternal, neonatal, and child health information in slum areas, and also to recommend that future research focus on enhancing app design and functionality. It is very, very important that we check out the app so that we can appreciate it more, because I failed to demonstrate it for you. I thought I would. There is maybe I don't know how to navigate this technology, but there is a potential for scaling this solution to other underserved urban populations, not just in Uganda, not just in the East African region, but globally as well. I would like to thank especially my supervisors, especially my primary supervisor, Dr. Texila, and then, of course, to the organizers of this presentation, of this work, the Texila American University, and all participants who are here, as well as collaborators. And of course, a special thanks to the health facility in charges, the Ministry of Health in Uganda, and then the Division Medical Officers in Kampala. Thank you very much.
Thank you so much, Mr. Michael, for the presentation. And dear participants, if you have any questions, please write in the chat box so that Mr. Michael can address. There is a question, Mr. Michael. Was this scaled up in Kampala, Uganda, anywhere else? That's a question, one question. And the second question, how he hopes to bring policymakers on board to implement the use of the mobile application, seeing the response from users and the benefits of the app. That's the second question. And did the study have any limitations? These are the questions raised by the presenters.
Oh, the questions have all been exhausted. Okay. All right. Yes, I can share. Thank you very much for this question. I think the first question has to do with whether I am who owns the app. Am I the one who owns it, or is it the Minister of Health? No, it is my app actually, and I intend to tell you the truth. I intend to commercialize it. This was for my PhD study, which I just completed. I haven't defended, but I guess immediately after defense, I'm working on patenting this solution, and I'm going to commercialize it. So if there's any people here, whether it's the moderator or any other person, the panelists, or the students, and everyone here who is interested in collaboration, yeah, we can speak. I'm going to share my email address, and I'm going to share the presentation as well, so you can learn more a little bit about it. I like the question on how to bring the policymakers on board. I think that using the data from this study to show, to show the effectiveness of the smartphone application in um, improving maternal, newborn, and child health outcomes in slum settlements. Presenting evidence-based results is one of the ways that I can bring policymakers on board, but also sharing case studies and testimonials. I believe that sharing these success stories, and you have missed out the part where I get to demonstrate and show testimonials where these people, the respondents in the study, and every other person who has really involved in this study uh, got to talk about what they liked about the study. So I think those were the questions. I don't know if there's one or two that I've left out. Oh, okay. So I think there was one. There was one about the limitations of the study. What were the limitations of the study? Number one, uh, of course, while sufficient for initial analysis, 200 participants uh, is relatively a small sample size. So a larger sample size would provide more robust and generalizable results. But this was for study, for my degree purposes. But also convenient sampling as a method of sampling limits the ability to generalize findings to the entire population of women in slum settlements. Yeah, but it was what we could realistically depend on for this study. Then also the short pilot duration. Okay, the duration of the pilot testing phase was limited, which may not have allowed for the observation of the long-term impact and sustainability of the smartphone application. I wanted to say also technological barriers, obviously, because smartphone ownership was high among participants. There were varying levels of technological literacy and comfort with apps, and that affected the consistent and effective use of the application. Um, then also, the study was limited in scope. It focused on specific slum settlements in Kampala City, which may have unique socio-economic and cultural context. These findings might not be directly applicable to slum settlements in other regions with different characteristics. I don't know how it is elsewhere. Um, yeah, I think those, yeah, also internet connectivity. Internet connectivity, actually, I had to pay, I had to spend a lot of money trying to get people to have internet so that they can connect. So inconsistent internet connectivity in plant areas, especially by rich people. We don't have issues with connectivity, but really the money to buy the data bundle. Of course, there has been limited follow-up because follow-up requires money. It requires other resources like human resources and time. So there's been limited follow-up to the participants after the initial pilot phase, and that's obviously because they had a lot of zeal. The participants needed this app, and they kept on calling me even beyond my study. But this can prevent the economic data on long-term usability and behavior changes. So I think those are some of the limitations. Thank you very much.
Thank you so much, Mr. Michael, on the presentation done by Mr. Michael on the topic of viability of a smartphone application on accessibility to information on maternal, newborn, and child healthcare in some slum settlements in Uganda.